All right. Well, Dr. Thato Chidarikire, Director for HIV and Prevention Strategies at the National Department of Health, and now joins us via Zoom for more on the story of the Health Department, the Deputy Minister of Health, Sbongiseni Dlomo, launching the National Youth HIV Prevention Strategy and a campaign, a culmination, of course, of Youth Month activities and initiatives. Dr. Thato Chidarikire, a very good afternoon to you. Thank you so very much for joining us here on SABC News.
Thank you so much for inviting me. Good afternoon to you and good afternoon to the viewers. Thank you.
Good afternoon to you as well. All right, so we are wrapping up Youth Month, which focuses obviously quite extensively on the youth and some of their challenges, HIV being one of the many challenges that the youth are facing. What exactly is the plan with this youth HIV prevention strategy? Talk to us about this strategy, not only that, but how different is it from the other past interventions and strategies that we've seen in the past?
Right. So this strategy is actually a guide towards our rolling campaigns that we are going to be implementing, especially targeting the young people. So in the past, we have had different implementation strategies, not necessarily guided through rolling campaigns. So what this strategy is doing is to make sure that we get guided in that way, that we look at, for example, we look at our health calendars, we look at where the burden is high, and we keep moving throughout the country over the next 2 to 3 years till 2025 to ensure that we align, for example, to the Global AIDS strategy, we align to the upcoming National Strategic Plan, the Department of Health Strategic Plan, and we make sure that we get to that point by 2025 where we have reduced incidence of young people of HIV by 50%.
Yeah, I mean, in terms of the strategies that the department is launching to ensure that there is awareness around the disease, so that people don't, I'm assuming, so that youth don't become complacent. What are you finding are some of the issues that are contributing to the youth perhaps becoming complacent about the disease? And I thought it would be interesting to maybe talk about, how the pandemic, the fact that we've been dealing with COVID-19 might have also put, awareness around HIV and AIDS, on the back burner, and people were perhaps starting to focus too much on COVID-19, rightly so, but then at the expense of HIV and AIDS.
So COVID-19 came into the world, not just South Africa, and we were all unprepared for what it actually brought. And we had to react. South Africa, just like the rest of the world, had to react to an unknown illness that was actually not just making people sick, but that was also killing people. It became a pandemic within a very short space of time.
Yeah.
So yes, we had to move the resources, both human and otherwise, to ensure that we target this new unknown that we were all confronted with. However, even though it affected the services for HIV, it is important to note that clinics were not really closed per se, even though it was difficult, especially in the hard lockdown, because of access. Access was difficult there. However, as soon as we managed to deal with COVID at the beginning, we loosened up the regulations, we were able to move, and the resources were also spread so that we were able to make sure that we do not reverse the gains that we had actually the traction for HIV while we are responding to COVID-19. So in terms of young people, when it comes to health, which usually gives biomedical interventions, and keeping in mind that when we talk about prevention, it is combination, not just biomedical, but social as well as structural factors, which is why the approach is multisectoral. As the MEC was saying, it's not just health, but everybody else needs to have their hands on deck to ensure that we respond to HIV. And we keep expanding the bucket of interventions. We keep introducing new interventions because what's important is choice. People, especially young people, need to know and understand that they have a choice in terms of prevention interventions, most of which can be used together to ensure that we manage and we fight the infections as hard and from all sides.
Yeah, Dr. Thato, let's also just briefly talk about the stats in terms of how bad it is when we're talking HIV infections amongst the youth. I was reading some sort of survey that also pointed to the fact that when we're talking HIV, we're also talking about the young women, and the understanding is that they engage in sexual activities with men that are older and more experienced than they are. And I wonder if that's necessarily factual, and if that is the sort of trend that you are in fact seeing.
Well, when this came into our HIV space, it was actually based on fact, because when we talk about issues of incidence or even prevalence, it's based on facts. So for the issue of young girls or the young woman, adolescent girl and young woman, this was informed by a phylogenetic study that was conducted in KZN in Hlabisa through CAPRISA. And the study showed that young women, on average about 18, were actually infected by the older men between 25 and 35.
Yeah.
And then the cycle moves such that then the young woman gets older, and then they meet the younger boy who was actually their age mate at the time, and then they start infecting them. The young boy then grows up, reaches the 25 to 35, goes down, and infects another young person who is at this time 18. So it's a cycle, which is a chain that we are trying to break with all these prevention interventions. So we have targeted interventions. You need to know your epidemic in order to know your response. And if you want to have impact, you need to target. And our targeted interventions are such that we have what we call a men's health strategy now that targets young boys, adolescent boy, and young men, and men in general, to make sure that we have specific interventions for men. And we also continue with specific interventions for adolescent girls and young women. We still have our interventions in place there, and we try to ensure that we reach out to both young girls and young boys, adolescent boys and adolescent girls, to ensure that we all grow up getting to that stage where we have managed infections in both boys and girls. Because when we look at the burden, it's disproportionate, and it's always been for the fact that, yes, young people, when you look at our surveys, you'll see that sexual debut starts early, especially in women, in young girls. You'll find that multiple concurrent relationship, age-disparate relationship, and there's a whole lot of power struggles where young women especially do not have that power to negotiate safe-sex interventions because they are in a relationship with a much older man. So those are some of the issues that are actually affecting young girls when you compare to their counterparts in terms of age.
All right, Dr. Thato, a great pleasure speaking to you. Thank you so very much for giving us your time. Informative indeed, and certainly good luck with those interventions and strategies that you are indeed putting in place. Thank you.
Thank you so much.
All right, that is Dr. Thato Chidarikire, Director of HIV and Prevention Strategies at the National Department of Health.